Hello, my name is Rachel Stout Cunnyngham, and I'm a nurse practitioner student at East Tennessee State University, and I'm going to be discussing the geriatric syndrome of falls. A fall is defined as an unplanned descent to the floor or an extension of the floor with or without injury to the patient. There are several statistics about falls for older adults. As you can see, greater than 3.1 million falls occurred in 2016 for people ages 65 and older. 62.6% of all falls account for unintentional injuries. 1 in 4 adults age 65 or older reported falling. There were almost 30,000 deaths in adults aged 65 or older in 2016 from falls. People aged 85 or older are more likely to die from a fall. From 2007 to 2016, there was a 31% increase in falls for older adults aged 65 and older. EB is an 89-year-old Caucasian male that we'll be discussing for this slideshow. He resided at home until he was age 87, but he began having falls. So his wife already lived in this long-term care facility that he now resides in. Since his admission at the long-term care facility, he's not had any falls. He has no drug allergies. He's on lisinopril, hydrochlorothiazide, Zocor, Lortab, Synthroid, Colace, and he takes Maalox and Metamucil as needed. He's up to date on all his immunizations for his age, and he does take his yearly flu shot. He regularly sees his dentist, cardiologist, ophthalmologist, and as needed, he'll see the primary care provider at the nursing home. He no longer has colonoscopies, but he did have those up until age 76. He has multiple diagnoses, coronary artery disease, carotid artery stenosis, aortic stenosis, dyslipidemia, GERD, polyosteoarthritis, hypothyroidism, hypertension, hearing loss, diverticulosis, anxiety, and depression. The subjective data collection on this patient was pretty unremarkable. He does report some arthritis pain, but he denied any pain when I seen him. He does take his Lortab as needed for that pain. He didn't have any complaints of fever or chills, general malaise, coughing, weight loss or weight gain. He denied any difficulty sleeping or any falls. He does wear glasses, and if he wears his glasses, he sees fine, but sometimes he doesn't want to wear those, especially if he's lying in his bed watching the television. He also wears dentures. He doesn't always have those in. I've seen him a couple times in passing, and he didn't have his dentures in, but he does state that he wears those when he eats. He has hearing aids that he wears sometimes. He complains that they squawk, so he'll take those out when they're doing that. But he didn't really have any complaints of that. The most that he complained about was joint pain, but he says he manages that fine. He's not had any falls or any impaired mobility. He actually walks well. He does sometimes use a wheelchair to get around the nursing home, but really could do without it. Objective data findings for this patient were very benign as well. He was alert and oriented. His vital signs were stable. He appeared much younger than his stated age. I would have not imagined he was 89 until I actually looked at his chart and asked him his age. He does look very young compared to what most 89-year-olds, I suppose, would look like. He's alert to the place he's at, his situation. He's very pleasant and cooperative with my assessment, and there was no distress that I appreciated through his exam. His hearing's reduced, and he was unable to hear the whispered voice, but if he wears his hearing aids, I imagine that he would be able to hear it fine. His cardiovascular exam did reveal a very predominant systolic murmur. He has aortic stenosis, and the murmur was very pronounced. I could hear it quite well. His Neurologic exam was very good. His gait's steady. He didn't have any tremor. He had good sensation to light touch and pinpricks. All of his cranial nerves appeared intact. His mental status exam score was 29, which indicated no impairments. His geriatric depression score was a 2, which suggested that he's not depressed, and he has good long-term memory recall as well as short-term. The patient was able to tell me what he had for dinner yesterday and breakfast this morning, and he answers all the questions appropriately, and he's very engaging throughout the exam. The pertinent tools for this patient were the hearing handicap inventory for the elderly. He scored a 12, which suggests that he has mild to moderate hearing handicap. He did not have his hearing aids in through this test, and sometimes I did have to repeat myself, but he did complain that the hearing aids were squawky today, and he just didn't want to wear them. The frailty assessment indicated that he was pre-frail, so it would be important to just monitor this patient for any deconditioning or any symptoms that he is becoming ill. The mini mental status exam score was a 29, and that score indicates that there was really no cognitive impairment. His depression screening tool was a 2, and scores less than 5. It suggests that he's not depressed. The Tenet Gait and Balance Scale score was a 22, and it does indicate that he's at moderate risk for falls, because he did have falls prior to coming into the nursing home. The nursing staff does monitor him quite closely for falls as well. The differential diagnosis and plan for this patient, I used a heart murmur due to hyperthyroidism or heart murmur due to anemia. However, his TSH was 2.002, which is with the normal limits, and his hemoglobin is 13.7. That could be ruled out with those laboratory results. The plan for this patient is just to continue his current medications, obtain his yearly labs, continue monitoring the patient for his safety and prevent injuries related to falls, and will continue to exercise as it's helpful to prevent falls. Differential diagnosis that we could use for falls would be visual impairment, gait impairments due to arthritis, and polypharmacy. The final diagnosis for this specific patient was just a routine health exam based on the physical findings. He does carry many diagnoses, but those are very stable. Community resources are needed for this patient, especially for exercise. Exercise interventions are associated with fewer people experiencing a fall, injurious falls, and people experiencing an injurious fall in average and high-risk community-dwelling older adults. This was a recent study that reviewed other studies, and exercise has been found to be the most effective. There's no specific type of exercise, though, that has been identified that prevent falls. So some community resources that could be utilized for exercise in older adults would be senior centers. Many seniors centers have exercise equipment for little or no cost to the patients that live in those counties or cities. The patients to get exercise could go to health clubs or gyms. They could utilize parks and nature trails. For this specific patient, he uses the physical therapy department. They have exercise equipment that he uses. And then if he lived at home, he could use home exercise equipment such as a treadmill or a stationary bicycle. Some discussion points for this patient in relation to the geriatric syndrome of falls. He does reside in a nursing home. Because of this, the environment in which he lives is not really under his control, so the furniture could be moved. The room could actually be moved. He could be placed in a different room. His bedside table could be moved. They could put mats down. They could change the position of the bathroom if they were to move his room. On some of the rooms, the bathroom is on the right side of the room, and others it's on the left side of the room. So that could be confusing and could cause him to be disoriented and possibly result in him falling. Has multiple medical conditions that could result in falls. The most concerning for me with his diagnosis is the osteoarthritis. His joint pain could impair his mobility and result in him not being able to move properly and result in him falling. The good thing, though, for this patient, he's still quite active and he does exercise regularly in the physical therapy room, and he does walk around the facility He does go outside and visits with family and different residents and friends. This patient may just be reluctant to ask for help and not request assistance when he needs it, because he is quite independent, given his living situation, which is not common for most nursing home residents. Some conclusions and final thoughts about falls. Through my research, I was quite surprised about the number of deaths that occur in elderly adults due to falls, and especially the fact that patients that are greater than 85 are more likely to die from a fall. Personally, I have fallen. I was in my mid 30s and it broke my foot. So, as an older adult, I'm going to be much more cognizant of that and much more aware that it could potentially cause me grave illness or even death. Through my experience and years of nursing, I've seen that some patients, after they fall, are much more anxious about falling, and it's going to be our job as nurse practitioners in the future to encourage those patients to continue to exercise so that they can build their strength and prevent falls, because not getting up can lead to other problems, as we know, such as pneumonia, different things that could, be end of life causing. And that's just it was a really eye opening thought for me. So I just definitely will be more uh, proactive in my plan of care for patients to prevent falls as a nurse practitioner in the future.